on. So what we're going to be talking about today is running gait analysis. So we're going to be talking a little bit about the logistics of how to do it, and then we're going to talk about some of the couple of the main things to look for. Obviously, this is a bit of a boiled down presentation. It presents a bit more expanded version of this on some of more the nuances, but we're going to cover off a lot of things and make this sort of nice and practical as well too. So when we look at what causes a running injury, so we obviously recognise that running injuries are multifactorial. So we've got lots of different contributors here. So we can look, ranging from things like genetics, which we don't have a great understanding of, structure, mechanics, which we're going to be talking about today. But then we've also got training loads, tissue qualities, and psychosocial factors as well too. So recognising that whilst we'll be talking today about running mechanics, realising that it's not all just about mechanics, that we need to be capturing data and information on all these things when we're dealing with an injured runner. So I like to start off first by saying that there is no best way to run, but there are often better ways. So there is not a single way, one way for people to run. You often notice that we are unique, and much like we've all got different fingerprints, we've all got a different gait fingerprint. So we can often see, spotting someone from a distance, that the way that they walk, we can see, oh, there's Alicia over there. I know how she walks well before I can see her face. So we've all got different ways to move, and therefore we're all going to have different variations in our running gait as well too. And so what we're going to be talking about, and with a lot of the measures that we deal and things that we look at, there's often a bandwidth of normal, if you say. So we might have someone that's on the extremes through here, but it's really, and this is, I guess, we'll talk about this a few times today, but when it comes to assessing running technique, I do it just as much as I have ever done. And really, we should be doing it on all our runners. There is at least assessing. And then comes the question, well, should we be intervening? And that's what I think I've found myself probably intervening less over time, but still assessing, because we don't know what we don't know, essentially. So running is a skill, and much like any other skill, whether that be swinging a golf club or swinging a tennis racket, there are ways to do it and there are better ways to do it. Now, with also, much like these particular movements are recognized and mapped in our motor cortex as a skill, it's the same with running. It's not just something that we do. There is a program, if you like, up through here, and so that program can be modified and changed. Now, if a particular activity hurts, then it's probably a good idea to assess it. Much like if it hurts someone they're squatting, they're saying, oh, when I squat, my back or my hip hurts. Well, we should probably look at how they're squatting. It's the same thing with running. If someone's sort of saying, well, it's hurting me to run, then it's probably common sense that we should be looking at how they run, and by doing that with a running gait analysis. So firstly, we look at some of the things that you may hear people say is, the way that you run is the way that you run, and can you even change running technique? And there's been a lot of research that's looked at that. So there's been studies that looked at those with patellofemoral pain, and they've found that those changes that were made through the intervention were maintained at 1 month and 3 months post-intervention. So that made a long-lasting change. Again, changes in dynamic knee movement were sustained at 1 month. Then looking at Willie's study as well too, increases in cadence were maintained at a month in the majority of the participants. And again, in Dybel's study, looking at those with exertional compartment syndrome, they were maintained at 6 weeks as well. So there's actually, we can see there long-lasting changes that can be made with post-intervention with running gait retraining. So probably more the relevant question is, should we be changing running technique? Now, we'll look at some of the reasons for and the reasons against. So one of the reasons for is symptom modification. And this is probably pretty relevant for us clinicians, because a lot of the time we're going to be having our runners come in with us with some form of injury. And so we're going to be dealing around the symptoms of those particular injuries. So there's been a number of studies that have showed both immediate and long-term improvement